Morning, everyone, and thanks for joining us. I assume everyone can hear me. We've invited you here today as employers and HR directors and coordinators to help us become early adopters and participate in the Kent County Back to Work Safely program. And this is something that is not unique to West Michigan. This is just who we are, to collaborate and come together and do something for the betterment of all. This program is developed in partnership with Kent County Health Department, Michigan State University College of Human Medicine, Meijer, and Spectrum Health. All of us are focused on developing the safest and most efficient way to build confidence and bring our employees back to work. And we want to do it the right way. This group has developed a plan to have multiple companies and sites throughout Kent County use the same employee health screening processes, including a daily data feed to Michigan State University. Michigan State will aggregate the data by zip code and allow Kent County's health department and area hospitals to monitor and assess possible hotspots throughout Kent County. I'm going to turn it over to Kevin Stotts, who's the president of Talent 2025, to get further into our program. But thank you again for participating. Kevin?
Yeah. Thank you, Sean. And thank you to so many of you as HR leaders for joining us this morning. I know this is an incredibly busy time, and this has been an unprecedented 8+ weeks for you as HR leaders in terms of slowing down your operations, establishing safe work environments, and then now hopefully for many of you ramping back up. And we talk about leading practices so often in our work, and I'm really quite excited because what we want to do is talk about a leading practice that comes to us from Meijer, who has developed, tested, and now has used this program every day at all their locations in the company. And I'm really excited to introduce Kathleen with Meijer to introduce this program and kind of give you the framework to give you the framework.
All right. Hey, Kevin. This is Paul Jekyll with
I'm sorry,
Meijer.
Paul.
No, that's okay. Hey, good morning, everyone. I just wanted to maybe walk you through a little bit in terms of our journey, maybe what we've seen as we've been doing this, and maybe give you a little bit of a behind the scenes of how this will operate and look and feel once you all establish it within your business. For us, we were fortunate enough early on to be identified as critical infrastructure for the state here in Michigan with our grocery, pharmacy, and gas business. And as we went into that, we fully acknowledged the fact that we were going to have to look at doing some things a little bit differently in order to maintain a healthy workforce, as our team members were not maybe going to be afforded the opportunity to take full advantage of a stay-at-home order. And so we did a series of things, and really about the last week of March, we established some mandatory health screening that we did in every one of our locations, from our distribution and manufacturing sites to our stores and even our corporate office, really across the entire company. And to date, I was just looking at our numbers this morning, we've conducted over 1.5 million health screens now on all of our team members that we conduct every individual day for everybody that's working in the building. That includes our vendor partnerships, any of our tenants that have leased space in the building, obviously our team members. And it's been, I would say, really a twofold approach. The first is really early on, we thought that may be something that we were going to get a degree of resistance on. And we actually didn't. We found that it turned into be something quite the opposite. It really quickly became something that our team member population identified as something that provided a degree of confidence and trust, that we were able to take an additional step of keeping them safe, whether it be directly while they're in the building, or even take it another step on another thing that would give them the confidence that they weren't transmitting a virus back to their home from them not being able to be at home through the full course of the day. I think the second thing is it gave us a degree of confidence that we were doing our part of being able to really send folks home that may have been in a degree of risk. And so for us, the way that this thing has worked has been about 35,000 health screens that we do per day across our entire footprint. And it's really centered around 4 key pieces. Candidly, it's about a 20-second investment for each of our team members daily to go through this. And we essentially ask them 3 questions and take a temp screen. The 3 questions are really trying to identify what happens by way of, our I guess, reflection of symptoms that are most known to be those that would be contributing against the symptoms known to be in COVID. The second would be identification of anybody that's been in close contact with somebody that's recently tested positive. And again, as I mentioned, we did really early on back in March. It's amazing when you think about how fast the time changes. But if you remember, about 45 days ago, travel was still something that had really not slowed down. The State Department hadn't really put in all of their control points related to individual countries of risk for international travel. And we still had people coming back from cruises. And so we added in a question that was immediately tied to identification of those travel components, whether it be internationally by way of air or by way of cruise ship. The last piece that we have is a temperature screen that we really try to identify anybody that's carrying a fever as well. And we're conducting this all on site. We did have some conversation early on as to whether or not we thought that this was going to be something that we'd want our team members to conduct on their own, or if we wanted to keep it in-house. And as I mentioned earlier, we ultimately said this was something we wanted to do in-house because, one, it had a representation to our team members of a degree of trust that we as an employer were doing these added steps. But 2, it was also good checks and balances because I think at the end of the day, we all find that our people ultimately want to come to work. And this was a good reinforcement that we wanted healthy people coming to work. And so that helped us really kind of keep this population clean. To date, we've sent about 5,000 of our team members home. And to me, I look at that as an added success because that's 5,000 people that, could have been potentially in our workforce for that particular day, infecting additional people or carrying, symptoms that would create concern or panic within our place of work, whether it be for our existing team members or even our customers in our space. And so we've been really pleased with it. We worked pretty early on with Dr. Beauchamp and several of the group from the Michigan State campus to try to understand the value of doing this. And we've been ultimately extremely pleased with it. One of the things that we do quite heavily is that we look at really what's our infection rate within our overall community of team members and compare that to the general population. And really, as I mentioned, we consider ourselves to be maybe a degree more at risk early on because we were open and we were essential and we did have customer traffic in and out of our buildings. But our overall infection rate for each of our 6 states remains positive in comparison to the general population as a whole. And so we felt like this was probably one of the number 1 components that helped us really keep that degree of health within the overall workforce. And happy to partner up with both Kent County, Spectrum Health, and Michigan State to really share some of those best practices and help kind of establish a degree of baseline here for Kent County business as a whole. So Kevin, I'll hand it back over to you.
Okay. Paul, thank you. And what Meijer has done is just truly remarkable. You were literally building the plane while you were flying it because you were delivering on, sort of the necessities that so many across the state needed, not closing your stores and really seeing it as being an essential operation for the state of Michigan and really across the Midwest. And what you've been able to do so quickly in terms of testing with everything I'm sure you're doing in the stores has contributed to really a sort of a case study in how to do the symptom assessment, coupled with all the other things you're doing as an employer to get to the results and outcomes where your employee population has fewer symptoms within it than the neighboring communities in which you operate your stores. And so it's really a testament to everyone at Meijer and the Meijer team for doing so much so quickly to get the result that you have. And I'm really excited to be able to share what you've done with employers across West Michigan, these HR leaders who put into place their own practices and activities or maybe are really looking for good solutions to be able to do that very, very quickly. So our plan with this call is to launch this and introduce this to as many employers in Kent County this week in launching this. And I want to ask Kathleen Oberst, Director of the Institute of Health Policy at Michigan State University and the College of Human Medicine, to help us understand how MSU has built out its end of this program and hear more of the details. So Kathleen, thank you.
Thanks, Kevin. And thank you all for the remarkable West Michigan entrepreneurship to have the vision to pull this all together so quickly. MSU College of Human Medicine's role is to really be the back room of this program. We've developed two programs, one to identify workplace locations and the other to obtain the health screening information using an online survey site. This is all consistent with CDC guidelines, and you would do this screening every day for every employee that walks into your organization. The data is going to be aggregated by our institute, and then we will share that with the Kent County Health Department so that they, along with the hospitals, would be able to assess if there were any hotspots in the county. So now we want to take a look and show you the two forms that you need to fill out. We'll go ahead and present them on the screen here. And it's really important to have the consistent information that they gather. So this first slide is really just what we're calling the business registration. So who's the business? Who's the contact? Where are they located? What's the contact information that we have for them? Email, phone, the usual things here: address, city, zip, and county. I will note that we are not taking any employee-specific data. So we will ask every site to fill out this form for every and submit it for every location that they have. So if you have two plants in two different locations, we do need you to register each one. For instance, in the case of Meijer, they have more than 20 locations in Kent County, and they are feeding data from each location. So this is the next slide, and this is the actual health screen input site. And the importance of getting each business being located is that you will actually get individual links for every site. So you can see here, it's pretty straightforward, and you can do this in several different ways. So you can have the employer administer the survey for each employee as they show up, or you can ask the employee to complete the surveys on personal mobile devices as they enter the facility. So we would recommend that you have two lines. The first is for the employees that are doing the link on their own, and they enter these questions. And if they are presented the question about a temperature check, then they would show that to your designated checker. They move in to have a quick temperature check, and they're good to go. The second line would be for individuals who do not have their own mobile device. And then your designated checker can quickly walk through these questions. The questionnaire can be used on any iPad or device that can hit the internet. We do recommend a touch device. It's a little bit easier to scroll through. And then once the employees pass the health screens in the Qualtrics site, then they pass their temperature check. Again, they're allowed into the building. If an employee does not pass the check, the questions, they actually will not take a temperature because they have to go home. This is where your HR policy will need to come into play. You don't want them in the workplace at this time. So to reiterate, this is done online. You can use any device, and it's built off a Qualtrics survey system, and then we can obtain the data from that daily. So again, MSU will be responsible for aggregating the data, and then we will pass it off to Kent County Health Department so they can monitor and assess for possible hotspots every day. Now, as Paul explained, and you saw the questions, we'll have information on symptoms, temperature tests, and we'll know if an employee has been sent home, and we will pass that information to the county by zip code. But just to reiterate, this is an entrance assessment for the employee to come to work. We still need to maintain CDC and OSHA guidelines within the workplace, including consistent, well-marked social spacing in all areas, shields where spacing is not possible, masks in all public-facing areas, washing hands, and sanitizing all areas of work. So now I'd like to invite Mary Beth Van Til, Strategy and Performance Management Manager for Kent County, to give you a macro overview of how this data can be used with companies and the local hospitals. So Mary Beth?
Thanks, Kathleen. Let me share some of the behind-the-scenes partnerships that have occurred to deliver this to you so quickly as our community comes back to work. It has truly been kind of a fast-paced ride the last couple of weeks as we've developed this process with Meijer. So besides Dr. Adam London, our Administrative Health Officer for Kent County Health Department, and our business leaders, Rick Keys, Doug DeVos, and Mike Jananoa, I want to thank Mark Washington, Grand Rapids City Manager, for helping us ensure that we will have support on the small business level throughout the city and the county. As Kathleen shared, Kent County Health Department will host a business microsite that will invite employers to sign up and set this process up immediately. Once you've registered, each employer contact person will receive a link that will allow for immediate screening participation. I want to thank the City of Grand Rapids for being one of our first test sites. They have the Grand Rapids Police Department and City Hall set up this week to begin processing the data. And all hospitals, Spectrum, Mercy Health, Metro Health, and Mary Free Bed, as well as Pine Rest, are also now working with our team to align their employee information. Dr. London's team at the health department has built a special microsite where employer back-to-work information will be updated daily on our site. This is designed to help you as you reopen your businesses. This site will include a number of things. It'll have information about COVID-19. It'll have Kent County Health Department contact information if you have further questions. It will house the employee health screening tool. It will have a return to work guide and a link to the registration that Kathleen mentioned. It will also have general safety workplace guidelines. Over time, this site is going to morph and change, and we will expand to include industry-specific information. We will have a thermometer ordering form. The site will be live on Tuesday, and we will share that link with you following this call. So there's a lot of information. We aren't going to be sending anything out to you as far as handouts because we want to keep that on the site so that we always have the most current information available for you. All of our documents will be dated so that you know that you have the most current piece of information. As that new information comes out, we'll push information out to you through the site, but we also want to keep open the idea that we might need to organize a call like this again to answer more questions to make sure that you have the most recent information. I want to do a shout out for Meijer, who has sourced a few thousand thermometers to help us get this program up and running immediately. They can be purchased using a credit card, and then they will be shipped to you priority mail. We will limit the number of thermometers for purchase at the beginning. They'll be coming in 2 phases. We have another allotment of them coming the week of the 18th. If you need more, we can order some more with about a 2-week turnaround and can make accommodations for those employers who might need help with purchasing the equipment. I want to turn it back over to Kevin, who is going to go over a few questions now.
Yeah, thank you, Mary Beth. And I've got joining me from my team at Talent 2025, Tammy Britton, who's going to be watching some of the questions that are coming through in the chat window. So we help all of you as HR leaders get your specific questions answered, and as we get ready to launch this program. So today is, there's many conversations involving employers related to getting back to work. We're working with Kent County, MSU, with the West Michigan Policy Forum, the Chambers of Commerce and Urban League, the Hispanic Chamber, and the Black Chamber, and to really sort of have a collective business effort for a safe return to work. So we're excited about the partnerships and the collaboration as Sean started our call this morning. Meijer is intaking, I think, 200 to 300 individuals per day at each location. And that's an unprecedented amount of volume, and you're doing that, as Paul talked about, very seamlessly. And so this is, once it's up and running, this is a program and an assessment system that's really easy to operate. And I think many of you as employers have already begun to do some sort of assessment or screening as at your places of work. And so we're excited to talk about how that gets integrated, what you're doing, and how it fits into this program. This is also a great confidence builder for employees. Heard this plenty of times among HR leaders, is that there's a heightened level of concern over the risk to my health, to the health of my family members if I were to become exposed to the workplace. This is one more method in order to address that and address that concern with your employees and be a good corporate citizen in that fashion. And as I said a bit earlier, our objective is to sign up as many employers as possible, because the data that is going to be derived from this program is really going to be key. And that helps with the accurate screenings, et cetera. And so we're excited to have as many of you participating as possible. And you're going to be getting some follow-up information and an invitation to participate after this web conference. With that, I want to sort of turn it back over to Kathleen and Mary Beth to answer some of the questions. Mary Beth, can you reiterate what types of employers can use this program, and is there a cost?
There is no cost, and every employer should be using this type of health screening if their employers are coming back to work. Once screened, then they should be following all of the OSHA and CDC guidelines for a safe workplace.
What about, does an employer or the employee need to be worried about being identified as sick by participating in the screening process?
Absolutely not. We are not collecting any person or employee specific information. If our Kent County Health Department starts seeing an issue on a particular zip code or at a specific employer site, they will only be contacting the person whose contact name we've been given on that registration site for follow-up.
Good. And I know that there's employers and HR leaders on this call have already implemented their own screening or assessment system as their employees are arriving into work. Is there a way to sort of take that data and integrate, what I'm doing as an employer and the data I've already collected into what the county and MSU are doing today?
Absolutely. So we have some employers who have already started their own screening tool, and what we are doing is matching kind of what they are asking and what data we need. And I don't want to speak for Kathleen here, but she's been working feverishly to integrate with employers who are already sending her a data feed, as well as those who are going to adopt our Qualtrics survey that she displayed on the screen. But the biggest thing really is to have all employers sending us that data. It gives us a more complete picture of what is happening in the county when we can see all of it together.
Good. Yeah, that's really exciting. You're able to do that with the information that's already been collected. How soon will the county, if you're launching this program this week, how soon will the county have the data available for the public to see?
We already are gathering that data. Right now we have Meyer, Spectrum Health, City of Grand Rapids already doing, and a number of other test sites that are already feeding us that data. So we can start our analysis on the back end so that we can start looking for those hotspot occurrences.
Good. I want to encourage you to put in some questions in the chat window so we can get all of your questions and concerns answered. Tammy, are there any questions you see that that are coming through that we should ask Kathleen, Paul, and Mary Beth?
Hi, Kevin. One of the repeated, can you hear me?
Yes.
Yep.
Okay. One of the repeated questions was about employers who are already doing this, and could that translate into the MSU system? So that one was already answered. One of the first questions that was in the chat box was, how timely does the data need to be entered?
I guess I need to understand the question a little bit more. As far as timely, we'd like to, every employee, every day that they're coming to work, to be able to do this screening. And then we are getting that information and aggregating that kind of on a nightly cycle for analysis.
Kathleen, I got a question for you. There was Will there be a Spanish language version of the screening for employees who need that assistance?
We have talked about that. We haven't implemented that yet. If Paul is still on the line, he can tell what the Myers experience was. They did a number of translations. So we will be exploring that to put that out. Paul,
Yeah,
are you?
Yeah, I'll speak to that just a little bit. So the Spanish piece is a big thing. As I mentioned earlier, this is about a 20-second investment for a team member to go through that. Now, in all honesty and transparency, the first couple days are a bit clunky as people are getting themselves calibrated, both with using the system, familiarizing themselves with symptoms that are unique and abnormal to them. And it takes about 2 or 3 days for people to really get into the routine of it. One of the best practices that we did is, really two. One is make sure that you've got a designated location within your building so that people understand that this is normal and that's a checkpoint that I go to every day. The second thing is, once that's established, we put the poster up. So even though we're verbally asking them the questions and doing a real-time entry, we've got a poster that reminds them of what those questions are. And we did that both in Spanish as well as in English. For our locations that have a heavy Spanish. One of our manufacturing sites, I think we speak a total of 27 different languages within that particular facility. And so we've pre-established that and made that available with some of our translation services that we have, that we use internally to Meyer. And that has helped expedite really kind of, one, this idea of not getting lost in translation for interpretation, but two, also keeping the line moving so that people understand that it's always in the same sequence of questions and relevant for how this thing needs to ultimately be captured and collected.
Mm-hmm. A question from Michelle: while utilizing the Qualtrics system for aggregation purposes, is it possible to have the employer-specific, I think it's the employer-specific information, bounce back to the employer once it's been answered? As so the individual employer can have records of this to validate their actions and support for the organization?
We could set up some exports, individual exports for that. There's not an automatic bounce back.
Okay, good. Tammy, what are the questions are you seeing in the from our guests on the call?
One of the questions I'm seeing is for an organization that has multiple locations, can they use the same Qualtrics system for locations outside of Kent County so they don't have to use multiple systems?
The system is able to set it up as long as every business gets registered and every unique instance of that business gets registered. You will receive an individual link for each one of those settings. So and in fact, I was in the site this morning, and we do have some places from outside of Kent County, but as long as they manage those individual links, then we'll be able to refine it as needed on the back end.
Good. A question on thermometers. How do the employers order them if they don't have them already?
So on that microsite that I referenced earlier, we will have a dedicated link for ordering thermometers that we can process and fill from there.
Good. And following up on that, Mary Beth, I know that there's employers who've already purchased thermometers. Will any thermometer do, or do you have a preferred type of device for this process?
I think any thermometer will do. It's probably quickest if you use one of the touchless thermometers, because that way you can get your reading and keep on moving through. There's no wait with that. So.
Okay, good. Tammy, any other questions?
One very specific question I saw was, for an employer who wants to do this, who's the best point of contact for the employer?
Well, I'll answer on behalf of what Meyer did. So we've established a corporate program oversight, which is led within my team here corporately, but each individual location we've established, they have essentially an assistant store director that we put as a point of contact should the inquiries come back from either Kent County or MSU, that if there's any follow-up that's needed, Mary Beth or Kathleen aren't having to circle back to me directly at the corporate office to say, hey, I have a little bit of a follow-up I want to do with your location on 28th Street in Cascade. We've tried to expedite that. So, I think it's really somebody that has familiarity with the program being administered and somebody that's able to, facilitate the conversation with, any follow-up that's needed. So, it's really up to, I guess, the business from that standpoint.
Yeah, kind of following up, and I don't know which of the three of you this is answered best by, but it's a question from Phil Weaver. If I'm setting up my process, who would I talk to have kind of check my processes and make sure I'm setting up my program correctly?
I'll jump in real quick. As far as if you want to validate the information going into Qualtrics, I can help with any of that technical aspect. If people have questions.
So on the data side, Kathleen, with MSU, probably process, et cetera, that would be Mary Beth, correct?
Yeah, I can help out with some of that, and also lean on Paul for their best practices over at Meyer, because they're the ones that have been doing this for quite a while now. So they've lived through all the pain points so that we don't have to.
Yeah, and I know that there's going to be sort of a best practice guide for setting up this program if I'm a new employer sort of coming in to get established and be a participant. So I know that'll be forthcoming very soon.
Correct.
Good. Tammy, more questions from our guests.
Yes, I'm paraphrasing this one, but one of the questions refers to not being open or not being functioning at full capacity yet and just having a very small staff. Is now the best time to start this, or should it be held off until the future?
I would say absolutely now. In fact, you can work out your own kinks with a limited number of people so that then you'll be ready for implementation when you have that larger workforce coming in.
I'm going to add to that, Mary Beth. This is Ginny Seifert talking. We started with 3 people. We learned a lot by being a very small employer with just 3 people back in the office. We're now up to 30, and we picked up probably a half an hour of entry time by starting small and working it through.
Another question that I'm seeing is if it can be set up for employees to do at home prior to arrival to the work site.
Yeah, Mary Beth, you want to cover that? I know that's a really important question in terms of the process and the assessment system working.
It is, and I'll probably ask Paul to jump in as well, because while technically you can set this up so an employee could do it prior to arriving at work, I know Paul has really gotten some great feedback because they are doing it on site.
Yeah, I think that we explored that issue pretty early on. I think that there's two pieces here. And as we were getting this thing kicked off and having the early conversations, one of the things that I think is as you're setting up your program that becomes valuable is maybe how this fits together. And one, if an individual is already starting to self-identify that they've got symptoms or that they know that they're going to fail that, it probably makes sense for them not to even come in just to be failed on a health screen and go away. And so establishing that type of an awareness that, healthy is what gets you to work. Passing the health screen is what gets you, to start working that day, I think is probably the standard. In terms of, why we opted not to do a self-screening at home is one, that the optics of us facilitating that. I think what sometimes get lost in this health screen is that the health screen is not exclusively for the individual being screened. The health screen is really for the broader population of people that are working alongside of them. And so that degree of trust that we talked about earlier, of having that visual representation that knows that the person that's working next to me has gone through this as well, really guided us pretty heavily early on, that we did not see a significant call-in rate of fear of being in the workforce. It really provided that degree of confidence that people that I'm working alongside of have gone through the screening, and I know that that person is in fact passed because they know that the employer has the routine built and established.
Good. Paul, kind of following up on that one too. I imagine you've got some employees that don't have access to email or a device to answer their questions on the phone. How have you managed that, having so many employees, so many different locations coming to work every day?
Yeah, so very similar to how Kathleen and Mary Beth talked about it. Now we're one of the groups that has a platform that we feed our data into Michigan State, and so the individual that we identify at a store to do the intake has a handheld device. They have the questions on there. They're verbally asking those of the team member at the beginning of their shift, and that way the team member never has to have access to that. We're not having to transmit a device back and forth with contact points that need to be cleaned and sanitized after each individual one. And so this is a verbal conversation that happens between me and the employee, and I'm doing all that entry and finalizing on behalf of the team member. So we've eliminated that whole need of getting into what you just asked for, Kevin.
Good, good. And Kathleen, question, how does the data for an employee who doesn't come in to work because they have symptoms, how does that employee's data sort of get counted into into this data collection system?
It does not at this point. So when we get the information, for instance, from Meyer, it's only for the actual screen. So there is potentially folks that call in or don't show are not represented.
Okay.
In the summary.
And then the questions, there's just a few questions right now. Is the team thinking about adding any additional questions as you roll out this program and you get more employers adopting it? And do you think you see any changes or additions to the questions you're asking right now?
There is, in addition to the 2 questions that are there about the symptoms and then about the contacts, there is, like Paul had indicated, they used a travel question because it was pertinent at the time. We do have the ability to modify the questions. You know, we can go in anytime and add stuff. There are 4 or 5 demographic questions that are optional, but that we're collecting that to help the county out. As I said, they're optional, and as we get feedback, as more people begin to use the system and test the system, and certainly as CDC guidelines change, something might come up and we'll be able to modify on the fly if there's another key factor that we should be considering as far as returning to work.
Okay, good. Mary Beth, when employers are going through the assessment system at the workplace, for the employers, you having employers wear PPE and other protections as part of that process? What do you see employers do?
Absolutely. If you're having that face-to-face conversation, I would definitely encourage you to wear the PPE and encourage, your employees to wear that as well. And that'll be coming in that employer guide that we'll be publishing is, what is the protective wear that employees need to have on, as well as somebody who is doing that screening.
Mm-hmm. Good.
Kevin, another question that I'm seeing, Kevin, is how are you dealing with ADA and HIPAA protection when you are asking employee questions? Are you doing it privately?
I'm going to let Paul jump in on that because I know he had his staff go through some of that training.
Yep. So for us, we have it set up so that it's not customer facing. So we do it back by our time clocks as a general check-in point. And the individual that we've identified to be able to take the health screen, we've identified it as being a salaried manager. And for our instances, our salaried managers are HIPAA certified. Now, the reason that becomes a factor is because as soon as a failed health screen comes through, they know that they're handing that off to our leave management office, and that there's naturally going to be questions from the team member of, well, what does this mean? How long am I going to be out? Am I paid? Am I not paid? What are all the criteria that's associated with that? And so we work through all that stuff early on. That further conversation is happening in a private location, still obviously allowing for social distancing. But we acknowledge the fact that there's probably going to be questions that may come up afterwards that may get into a degree of privacy or other protected information.
Good. Yeah, thank you, Paul. Mary Beth, a question about the program and when this might end. And certainly there's an effort on the part of the employers to get this set up, but you're at the early stages of sort of establishing this program. Any sense of how long you think this is going to be necessary for employers in Kent County and soon across West Michigan?
I cannot speak completely on that. My best guess is until we have a vaccine available.
Yes, we all know that's
Be doing
that's
this.
estimated 12 to as early as 12, but as much as 18 or more months. So this is going to be a long-term play on the part of employers to ensure a safe work environment for their employees. A couple question I have is I know there's employers on this call that have operations in Kent County or in Barry, Ottawa, Muskegon as well. What is the plan to open this up? Is this being considered to engaging the other counties across West Michigan?
Ginny, do you want to hop in on that particular question as far as engaging Kent County region?
I would say that I think I heard it right. I'm sorry, you know me, I'm doing two of these at once. The question was how beyond Kent County for employers. So let me share with you that there are conversations happening today in Ottawa and Muskegon County, business to business leader, to ask them if they want to take the leadership role with their county, just as business leaders did here. And those, and then if the CEOs want to take that leadership role, Kent County would give them all of our resources, is what we've discussed. Does that make sense? So I would encourage your CEO to support that. And if they want to put the energy in, I think the plan is in place, and it's definitely designed to be scalable in a minute. Everything we've already done would be transferred over whichever county health department wants to take it. But you need some CEO leadership in place to pull people together. And I think Kevin already shared, I think we now have 111 companies on already, and it's growing. So it's really got to be grassroots up. No one wants to tell anyone to do it, but the model is definitely designed to be scalable.
Yeah, and I think that's sort of one of the beauties of what you, the partners in this have put together is just the scalability of this, and it's based on the best practice, the leading practice of Meijer in terms of, as we talked at the beginning of the call. I know we're getting close on our time, sort of a time limit of 9:45. I know that there's a few questions we were not able to get to. Also wanted to let you know that this call is being recorded. So at the end of this call, you're going to get a link and an invitation to participate. You can also respond directly with questions that you would like to have answers specifically or we didn't have time for. And there's also going to be that best practice guide that's going to be following very soon as this program gets launched in Kent County. If you have an interest as an employer of being part of that conversation with in other counties across West Michigan, please indicate that as well. I know, as Jenny said, that there's a lot of interest in Ottawa and Muskegon counties already, but the simplicity of this, coupled with the fact that employers are already doing this, I think makes it a really easy and scalable solution to help employers provide a safe work environment for their employees to come back to. And so with that, I want to thank you all for being on the call. Special thanks to Paul with Meijer, Kathleen at MSU, and Mary Beth with the Kent County Health Department. All of you for sort of putting this together. I know you've put some of these calls together last week and making the time to meet with so many HR leaders. I think we'll probably be doing a second call with some of the others that could not participate this morning, but really enthused with the interest and the turnout in this call, and looking forward to your participation beginning this week. So with that, thank you very much.